I want you to understand something important today. Your heart arteries can become narrowed and blocked over time, and this condition is called coronary artery disease. What most people do not realize is that certain fruits contain powerful compounds that can help protect these vital blood vessels, especially in elderly individuals who face the highest risk. This video is for information purposes only. It is not medical advice. For any health concerns, please consult a qualified doctor. Coronary artery disease develops when the arteries that supply blood to your heart muscle become damaged or diseased. This usually happens because of a buildup of fatty deposits called plaques on the inner walls of these arteries. Over time, these plaques can harden and narrow the arteries, reducing blood flow to the heart. When your heart does not get enough oxygen-rich blood, you may experience chest pain, shortness of breath, or even a heart attack. In elderly people, this risk becomes significantly higher because their arteries have been exposed to decades of potential damage from various factors. Age itself causes changes in the arterial walls that make them less flexible and more prone to damage. The cells lining these blood vessels become less efficient at repairing minor injuries, and inflammation tends to increase with age. This creates an environment where plaques can form more easily. High blood pressure, high cholesterol, diabetes, smoking, and obesity all contribute to the development of coronary artery disease. When these risk factors persist over many years, they accelerate the process of arterial damage. Elderly individuals often have multiple risk factors working together. The good news is that certain fruits contain specific nutrients and bioactive compounds that have been scientifically shown to support cardiovascular health. These natural substances can help reduce inflammation, lower cholesterol levels, improve blood vessel function, and decrease the formation of dangerous blood clots. The first fruit I want to discuss with you today is the apple. You may have heard the old saying that an apple a day keeps the doctor away, and there is actually strong scientific evidence supporting this for heart health. Apples contain a type of soluble fiber called pectin, which has remarkable effects on cholesterol levels. When you eat an apple, the pectin binds to cholesterol in your digestive system and helps remove it from your body before it can enter your bloodstream. Studies have shown that eating 1 or 2 apples daily can reduce LDL cholesterol, which is the harmful type that contributes to plaque formation in arteries. Apples also contain powerful antioxidants called polyphenols, particularly in their skin. These compounds help reduce oxidative stress and inflammation in blood vessels, which are key processes in the development of coronary artery disease. The flavonoids in apples have been linked to lower risk of heart disease in multiple large population studies. Research involving elderly participants has demonstrated that regular apple consumption is associated with improved endothelial function. The endothelium is the inner lining of your blood vessels, and when it functions properly, it helps regulate blood pressure and prevents clot formation. In aging arteries, endothelial function naturally declines, but the nutrients in apples can help slow this process. One study followed over 30,000 women for nearly 15 years and found that those who ate apples regularly had a significantly lower risk of dying from coronary heart disease. The protective effect was particularly strong in women over the age of 65. For elderly individuals, I recommend choosing apples with the skin on, because that is where most of the beneficial compounds are concentrated. Organic apples are preferable to reduce pesticide exposure, but if that is not possible, washing thoroughly is important. Eating the whole fruit is better than drinking apple juice because juice lacks the fiber and contains concentrated sugars. The second fruit that offers exceptional benefits for coronary artery disease is the pomegranate. This fruit has been used in traditional medicine for thousands of years, and modern science has now confirmed its powerful cardiovascular protective properties. Pomegranates contain an extraordinarily high concentration of polyphenols, even more than green tea. The main active compounds in pomegranates are called punicolagens, which are strong antioxidants that help prevent LDL cholesterol from oxidizing. Oxidized LDL is particularly dangerous because it promotes inflammation and plaque formation in arterial walls. By preventing this oxidation, pomegranates help slow the progression of atherosclerosis. Clinical studies have shown that pomegranate juice consumption can reduce blood pressure in people with hypertension, which is extremely common in elderly populations. High blood pressure damages the arterial walls over time and accelerates coronary artery disease. The reduction in blood pressure from pomegranate is modest but meaningful, especially when combined with other dietary modifications. Research has also demonstrated that pomegranate can improve blood flow to the heart in people who already have coronary artery disease. In one study, patients with severe coronary blockages who drank pomegranate juice daily for 3 months showed improved blood flow to their heart muscle during stress testing. This suggests that pomegranate may help the heart function better even when arteries are already narrowed. Another fascinating finding is that pomegranate appears to have anti-inflammatory effects, specifically in the arterial walls. Chronic inflammation is now recognized as a major driver of atherosclerosis, and reducing this inflammation can help stabilize existing plaques and prevent new ones from forming. For elderly individuals, I recommend consuming pomegranate in the form of fresh seeds or pure pomegranate juice without added sugars. The seeds contain fiber and additional nutrients, so eating the whole fruit is ideal. If you choose juice, look for products that are 100% pomegranate without sweeteners or other fruit juices mixed in. 1/4 to 1/2 cup of pomegranate seeds daily, or about 4 to 8 ounces of pure pomegranate juice, appears to be the amount associated with cardiovascular benefits in research studies. However, if you are taking certain medications, especially blood thinners or blood pressure medications, you should consult your doctor before adding large amounts of pomegranate to your diet. The third fruit I want to tell you about is berries, particularly blueberries, strawberries, and blackberries. These small but powerful fruits are packed with compounds called anthocyanins, which give them their deep red, blue, and purple colors. Anthocyanins have been extensively studied for their cardiovascular protective effects. Research has shown that regular consumption of berries is associated with reduced risk of heart attacks, particularly in women. One large study found that women who ate 3 or more servings of blueberries and strawberries per week had a 32% lower risk of heart attack compared to those who ate berries less frequently. The anthocyanins in berries help improve the function of the endothelium, which, as I mentioned earlier, is the inner lining of blood vessels. Better endothelial function means improved regulation of blood pressure, reduced inflammation, and better prevention of blood clots. All of these effects are crucial for preventing complications of coronary artery disease. Berries also help reduce arterial stiffness, which is a major problem in elderly individuals. As arteries become stiffer with age, the heart has to work harder to pump blood, and this increases cardiovascular risk. Studies have shown that regular berry consumption can improve arterial flexibility and reduce this stiffness. The fiber content in berries also contributes to their heart protective effects by helping to lower cholesterol levels. Additionally, berries have a low glycemic index, which means they do not cause rapid spikes in blood sugar. This is particularly important for elderly people who may have diabetes or prediabetes, conditions that significantly increase coronary artery disease risk. Research specifically in older adults has demonstrated that daily berry consumption improves several markers of cardiovascular health, including blood pressure, cholesterol levels, and inflammatory markers. One study in elderly individuals with metabolic syndrome found that drinking a blueberry smoothie daily for 6 weeks improved insulin sensitivity and reduced cardiovascular risk factors. I recommend eating a variety of berries rather than focusing on just one type, because different berries contain different proportions of beneficial compounds. Fresh or frozen berries are both excellent choices, as freezing does not significantly reduce the anthocyanin content. Aim for at least 1/2 to 1 cup of mixed berries daily. You can add berries to oatmeal, yogurt, or smoothies, or simply eat them as a snack. Avoid berry products with added sugars, such as berry-flavored drinks or berry jams, as the added sugar can counteract the cardiovascular benefits. The whole fruit provides the most benefit because it contains fiber along with the beneficial phytochemicals. Now let me explain how these 3 fruits work together to provide comprehensive cardiovascular protection. Each fruit offers unique compounds that target different aspects of coronary artery disease. Apples provide cholesterol-lowering fiber and antioxidants. Pomegranates offer powerful anti-inflammatory and blood pressure-lowering effects. And berries improve endothelial function and reduce arterial stiffness. When you incorporate all 3 of these fruits into your regular diet, you create a synergistic effect where multiple protective mechanisms are working simultaneously. This multifaceted approach is more effective than relying on any single nutrient or food. The combination addresses inflammation, oxidative stress, cholesterol levels, blood pressure, and blood vessel function. It is important to understand that these fruits are not a replacement for medical treatment if you already have coronary artery disease. They should be part of a comprehensive approach that includes any medications your doctor has prescribed, regular physical activity appropriate for your condition, stress management, and avoidance of smoking. If you have been diagnosed with coronary artery disease or have significant risk factors, your doctor may have prescribed medications such as statins for cholesterol, blood pressure medications, or antiplatelet drugs like aspirin. These medications are proven to reduce heart attacks and save lives, and you should never stop taking them without consulting your doctor. The fruits I have discussed today work best as part of an overall heart-healthy diet that emphasizes vegetables, whole grains, lean proteins, nuts, seeds, and healthy fats while limiting processed foods, added sugars, and excessive sodium. The Mediterranean diet pattern, which naturally includes plenty of fruits, has been shown to significantly reduce cardiovascular disease risk. For elderly individuals, there are some practical considerations when adding these fruits to the diet. If you have difficulty chewing, you can blend apples into smoothies or cook them until soft. Pomegranate seeds can be sprinkled on soft foods like yogurt or oatmeal. Berries are naturally soft and easy to chew. Some people worry about the natural sugar content in fruits, but for most elderly individuals without severe diabetes, The benefits of these fruits far outweigh any concerns about their natural sugars. The fiber, water content, and beneficial compounds in whole fruits mean that the sugars are absorbed slowly and do not cause the same blood sugar spikes as added sugars or refined carbohydrates. However, if you have diabetes, you should monitor your blood sugar response to these fruits and discuss appropriate portion sizes with your doctor or dietitian. Generally, spreading fruit consumption throughout the day rather than eating large amounts at once helps minimize blood sugar fluctuations. Let me address medication interactions because this is crucial for elderly individuals who often take multiple medications. Pomegranate can interact with certain drugs, including some statins, blood pressure medications, and blood thinners. If you take any prescription medications, discuss adding pomegranate juice to your diet with your doctor or pharmacist. The timing of fruit consumption can also matter for some people. Eating fruit with meals that contain fat or protein can slow sugar absorption and provide more stable blood sugar levels. This is particularly helpful for elderly individuals with insulin resistance or diabetes. Quality and freshness matter when choosing these fruits. For apples, select firm fruits without bruises or soft spots and store them in the refrigerator to maintain freshness and nutrient content. For pomegranates, choose heavy fruits with tight, unblemished skin. For berries, look for plump, dry berries without mold and refrigerate them promptly. If fresh berries are expensive or unavailable where you live, frozen berries are an excellent alternative and are often frozen at peak ripeness, which preserves their nutrient content. Frozen berries can actually be more nutritious than fresh berries that have been stored for long periods or transported long distances. Washing all fruits thoroughly under running water before eating is important, whether they are organic or conventional. For berries and pomegranates, a gentle rinse is sufficient. For apples, you can use a produce brush to scrub the skin if you prefer. Now let me discuss what realistic expectations should be when adding these fruits to your diet. You will not see dramatic changes overnight. The cardiovascular benefits accumulate gradually over weeks, months, and years of consistent consumption. Think of these fruits as long-term investments in your heart health, rather than quick fixes. Research suggests that it takes at least several weeks of regular fruit consumption to see measurable changes in markers like LDL cholesterol or blood pressure. The most significant risk reduction for heart attacks and strokes is seen in studies where people consumed these fruits regularly for years. This is why consistency is more important than quantity. It is better to eat 1 apple daily for months than to eat 5 apples one day and then none for weeks. Regular, moderate consumption allows your body to maintain steady levels of the protective compounds and supports ongoing cardiovascular health. For elderly individuals who may have established coronary artery disease, these fruits cannot reverse severe blockages or replace the need for procedures like angioplasty or bypass surgery when those are medically necessary. However, they can help slow disease progression, reduce inflammation, and support overall cardiovascular function. Even if you have already had a heart attack or have been diagnosed with significant coronary blockages, adding these fruits to your diet can still provide benefits. Studies show that improving diet quality after a cardiac event reduces the risk of future events and improves quality of life. Another practical tip for elderly individuals is to prepare these fruits in ways that make them easy and enjoyable to eat regularly. You can wash and cut apples into slices and store them in the refrigerator for quick snacks. You can portion pomegranate seeds into small containers for easy access. You can keep a supply of frozen berries ready to add to breakfast or smoothies. Making these fruits visible and convenient increases the likelihood that you will eat them regularly. Keep a bowl of apples on the counter or fresh berries in a clear container at eye level in the refrigerator. When healthy foods are easy to see and access, you are more likely to choose them. Let me summarize the key practical steps for incorporating these 3 fruits into your daily routine. First, make a plan to buy these fruits weekly. Add them to your grocery list and shop for them regularly so they are always available. Second, prepare the fruits in advance when possible. Wash apples and store them where you can easily grab one. Remove pomegranate seeds and portion them into containers. Wash berries and keep them ready to eat. Third, establish specific times to eat these fruits. Perhaps an apple with breakfast, berries as a mid-morning snack, and pomegranate seeds with lunch or dinner. Creating routines makes it easier to maintain consistent intake. Remember that coronary artery disease is a serious condition that requires comprehensive medical management. These fruits are powerful tools for supporting your cardiovascular health, but they work best as part of an overall strategy that includes medical care, medications when needed, physical activity, and other dietary improvements. The research supporting the cardiovascular benefits of apples, pomegranates, and berries is extensive and continues to grow. Scientists are still discovering new ways that the compounds in these fruits protect the heart and blood vessels. By eating these foods regularly, you are taking advantage of nature's pharmacy. For elderly individuals, every positive change you make for your heart health matters. Your arteries have been serving you for many decades, and giving them nutritional support through these fruits can help them continue functioning as well as possible. I encourage you to start today. Choose one of these 3 fruits and eat it with your next meal. Then plan how you will incorporate all 3 into your regular diet. Small steps taken consistently lead to meaningful improvements in health over time. If you have questions about whether these fruits are appropriate for your specific situation, particularly if you have diabetes, kidney disease, or take multiple medications, please discuss this with your doctor or a registered dietitian. Individualized guidance ensures that dietary changes support your overall health goals. Your heart works tirelessly every moment of every day, pumping blood to nourish your entire body. Supporting it with nutrient-rich foods like apples, pomegranates, and berries is one of the most loving things you can do for yourself. So if you like this video, please like and subscribe for more videos like this.